A beautiful afternoon to you. Many thanks for joining us on the program Healthy Living with yours sincerely, Oluije Oikokai. Today on Healthy Living, we're looking at asthma, the risks, the symptoms, and of course, possible management. And to do that with us is Dr. Ibifiri Hart Omoagie. She is consultant, physician, and pulmonologist, respiratory unit of the University of Benin Teaching Hospital. Good afternoon.
Good afternoon. Thanks for having me.
Okay, now we know it's the Harmattan season. Lots of persons are prone to having this kind of condition. Now, first off, we would like you to know that WHO in 2016 estimated that more than 339 million people had asthma globally, with about 417,918 deaths globally. Asthma is a public health problem, not just for high-income countries. It occurs in all countries regardless of the level of development. Now, most asthma-related deaths occur in low and lower middle-income countries. It is a common disease amongst children. Now, moving on to Nigeria, where about 1.5 million asthma cases occur per year. I will say that again. In Nigeria, there are about 1.5 million asthmatic cases that happens per year. So let's go to Dr. Ibifiri. We want to know asthma. What is asthma?
Okay, so before I start, I would like to just say, now that value you just talked about concerning Nigeria, that is actually the one that has been recorded.
Okay, so it has toppled.
You know, we have those who don't come to the hospitals, those who don't even go to seek care. They just try to treat themselves. There are quite a number of them. So that number has actually gone way ahead of that. Now, asthma is a chronic respiratory disease. Okay, so we call it a heterogeneous disease of the airway in the sense that it has various ways in which it can occur, or the various risk factors that can lead to it. Okay, so it's a heterogeneous disease of the airway characterized by chronic inflammation of the airway. The airway is the lungs, so the tiny part of the narrow part of the lungs. Okay, where we when those areas are chronically inflamed, to symptoms such as cough, wheezing, chest tightness, and difficulty in breathing. So those are the 4 cardinal symptoms. And then associated with expiratory airflow limitation, meaning that it's when the person is expiring, you have more limitation, and that's what we get when we do the test, which is done. So all this together is what we use as the definition of asthma. So asthma is a non-communicable disease. It's quite common, just like you've mentioned. It's more common than we think. And then it's a global problem because of first of all, lack of awareness in our region, talking of our region first of all. Secondly, the cost of treatment. That also affects like you mentioned, the poor and middle income earning countries. Yes, so that's the major issue.
For this program and this topic especially, now I got to know that there are different kinds of airways. Now, for those persons that are commonly prone to this attack, asthmatic attack, they have another type of airway. So I don't know. So how many type of airway do someone that doesn't have this asthmatic attack have, and the person that is prone to or have the asthmatic attack?
Okay, so generally we have just one type of airway.
Okay.
But in those who are asthmatic, theirs have a different conformation, so there's some change. For example, now, like I mentioned, asthma affects the tiny part of the airway. So the airway starts from the nose down backwards, the oropharynx, the pharynx, down to the trachea, and then the bronchi. So you have the bronchial tree, and then it ends at the alveoli. So those tiny, where the gas exchange occurs. Okay, asthma affects those tiny areas. And when the muscles there are affected, of course, that's when there will be trapping of air and all that. So
okay, so what would we say causes this this the airflow, the tiny particles that comes through the nose. What would you say causes these reactions?
Okay, so that brings us to the risk factors for asthma.
Okay.
Now, the risk factors include, first of all, we have the genetic predisposition. There are some people who will tell you, okay, my mom is asthmatic, my dad is asthmatic, so genetic predisposition. There are some genes that are responsible. The commonest one, we call it ADAM33 gene.
Okay.
There's a GPA gene, there's the ORMLD gene. So all these genes are, if we find them in people, we don't commonly assay them here, but these are genes that can be found in people who commonly have asthma. So genetic predisposition is one. Then we have the hygiene hypothesis. Okay, so before I'll talk about hygiene, I'll talk about immunologic. That's where this allergy comes into play. Because there are some people who just have this upregulation of that part of the immune system where they tend to have allergies because of some things that are being secreted. So when they come in contact with some allergen, that's the trigger thing that can cause stimulation of that immune system, they start having the allergic reactions. Okay. So that's the immunologic.
Yeah, because, sorry for cutting you short, I actually wrote down the question, is allergy and asthma, if they are related?
Very related, very, very related. We call it atopy. Okay. Now, the third one is the hygiene hypothesis I was trying to go through. So in the past, it was thought that, okay, asthma was a disease of clean children. So the white people noticed that there are children who, they're not exposed to dirt, they're not exposed to infections in childhood. They were wondering why they were coming down with asthma. So it was thought that for those who are exposed early enough, they make one part of the immune system to overshadow the allergic part.
Okay.
So the allergic part is downplayed while this part is upplayed. So in trying to curb infections, the normal infections which children come in contact with. But when it comes to those, so they now saw that, okay, for their kids who were not really exposed to those infections, they were having more of allergic reactions. And that's why it was thought that the hygiene hypothesis, that's how it came into play. Now the next is the environmental factor, where we have those who come into contact with chemicals like bleach, chemicals like those things found in cement, silica. All these things are known to actually predispose. And this is in those who have the predisposition, not like we just cause asthma per se. Now the last is where we talk about phenotypes. So there are some illnesses that come with asthma. For example, Chuck Strauss, one of the illness that was said to have killed our President Yaradua. So that disease comes with asthma, is a known part of it. So it doesn't necessarily mean he had allergy and all that, but asthma is, so there are some diseases that asthma is part of. So all these things are the risk factors for asthma.
So invariably, you're telling us now that asthma is not something we should, toy with.
No.
So what are these symptoms? Now, someone at home will want to know the symptoms that will play out for the person to know, okay, I need to quickly take myself or my child or my ward down to the hospital. So what are these symptoms that you start, getting to see day in, day out?
So, like I mentioned before, the 4 cardinal symptoms: cough, chest tightness, wheezing, and difficulty in breathing.
But are they all related to asthma? Sometimes someone might say, oh, I have pneumonia, I have flu. So
it's different. When it comes to pneumonia, we talk about fever, cough, difficulty in breathing.
Okay.
But with asthma, wheeze is one of the cardinal symptoms that it's almost universal. Now, there are other types of, there's a cough variant asthma where it's just cough, cough, cough. You come into contact with an allergic substance, it's just cough, cough, cough. It may not necessarily cause some difficulty in breathing as such at that time. But cough is a major factor. So I'd like to just talk about the triggers while talking about these presenting symptoms. So most triggers, the commonest ones, the allergens, the dust mites. So there's some people that say, oh, where they are sweeping, the stuff just makes me to start having an attack. Now, inside that dust particle, there's the mites, there are some insects
that we can't
dust.
see.
Yes, we can't see. They are so tiny. The physics of those things can trigger asthma when it is inhaled. Then cockroach, the skin of cockroaches. So in some places where cockroaches infest, people tend to have repeated attacks. Those who clean houses with bleach, mixing with detergent and all that can trigger it. Those who are exposed to wildfires, smoke, perfumes. So each individual should actually know what could trigger.
What
and of
triggers
course, the
them.
one that you cannot control, infections. And pneumonia, like you mentioned, can trigger asthmatic attacks. So that way, someone who has even been controlling himself well with his medications may see that the medications are no more effective because there's an underlying infection. So these are some things that can lead to those 4 cardinal symptoms, and then the person now starts to have, so that chest tightness
of the chest
really causes some major discomfort and difficulty breathing that results in the symptoms. So
So you made mention of cough,
yes,
tightness of the chest.
yes,
So what other
difficulty in breathing,
and
wheezing, like a whistle, like a whistle
when
sound.
okay, that's when someone is asleep.
Yes, well, it may be asleep.
Because we need to know what we are facing right now.
Yes.
Now you're talking about wheezing. Someone out there would not know what it means. So we want to know when. So is it when someone is asleep, or how does this happen?
The person doesn't need to be asleep. I can be sitting with you now and you'll be hearing like
a whistling sound
when we are just seated.
Okay.
So in some people, it may. Okay, most times asthma is commoner in the night. These symptoms are commoner at night for those who are not well controlled. For those who are well controlled on their medications, they don't even have all these symptoms. So that's why we keep telling people you can live free
a
of
normal
the symptoms.
life.
Yes, you can actually. So this wheezing is it's just when the person is breathing in and out. It just shows that the smaller airways are narrow.
Okay, now we are in the Harmattan season.
Yes.
So we want to know those persons that are prone to having asthma and those that have it currently right now. So what are your advice? What are those things they ought to do as regards the Harmattan season?
Okay, thank you for that. First of all, I'd like to say that the Harmattan season causes a lot of triggers. Number one, the Harmattan breeze goes with a lot of dust. Within this dust, there are the mites that can cause the allergic reactions. So those allergens are there. The dust particles themselves. Now, even the breeze still carries, it makes infections spread faster. For example, if you're living with someone coughing, with the breeze and everything, it can actually be transmitted faster than ideally it should be. And then, as well as the weather, the cold itself. Cold is one of the things that triggers an asthmatic attack. It can cause the airway to become tight and narrow. So these are things that can be as a result of the Harmattan. And what can we do to prevent this? The use of face masks to prevent this excessive dust. Another thing that occurs during the Harmattan season is wildfires. You know, a lot of bush burning and all that. Now, the smoke triggers a lot of attacks. So, number one, as an individual, use face masks when you're going out, especially the dusty areas. Avoid too much of overcrowded areas to prevent infection. For those who are asthmatic, we encourage them to take vaccines, like vaccines to prevent pneumonias, such as pneumococcal vaccine. Yes, so just to prevent pneumonias, ensure you've been vaccinated. Protect yourself too from the cold weather as well, because like I said, cold can trigger the airway to be tightened so that it can cause an attack. So these are some few things. Then for those who are farmers, of course, bush burning, if you want to burn, you need to be away. An asthmatic person shouldn't be found near wildfires like that because it can actually cause a trigger. Then apart from this, know what triggers yours and avoid it. For some women, we tell them if you use wigs a lot, you need to wash over and over again because a lot of dust can accumulate, yes, and then cause recurrent attacks. Your bed sheets, wash your beddings, your pillowcases weekly. If you have curtains in your room, wash them. Ensure you avoid the use of rugs. So things like that. Just avoid too much of dusty particles. If you need to sweep, you can sprinkle some water around the area to prevent dust from rising. Yes.
Okay, so
and of course, use your inhalers.
Yeah, very important. Now, has there been any research as regards this asthmatic attacks? Like we know when a child is born, we have some vaccines. So are there some research that are ongoing right now in order to maybe produce a vaccine to, to curb the menace of, the asthma and the attacks and all of that?
Okay, so asthma is not a communicable, it's a non-communicable disease,
you said so.
And it's not an infection. So there's really no vaccine against asthma. However, there are vaccines against infections that can trigger
okay.
asthmatic attacks. So that's why we tell people to take those vaccines, pneumococcal vaccine, influenza vaccine, just things that can prevent pneumonias and upper airway infections that can trigger these attacks. So those there's no vaccine against asthma itself.
We know things are very expensive in the country right now. And when we're talking, you said what do you call that now, the inhaler. Now it used to be 5,000 naira. Right now you say it goes for as much as 60,000 naira, if not even more than. So are there government organizations, or what can government actually do to help this person? Because we know asthma is a life-threatening disease. So what can government do? How can they come in to, to subsidize the rate of this inhalers that one can actually make use of?
Okay, so concerning that, I'll say on our own part, we can only keep advocating. We celebrate World Asthma Day every May, the first Tuesday in May every year. Okay. And for this year, this was basically what it was about, advocating for reduction in prices, for government support and all that, because a lot of patients have problems with being able to afford these inhalers. The prices have come down a bit, but they are still not as affordable as they should be. So you see a lot of patients coming with only we have the two broad classes. I'll just to make us understand it basically. Relievers, controllers. The relievers are the common one. Yes, this is what we used to use in the past actually, because the treatment keeps evolving. It has changed at the moment. So you see a lot of people coming with only that particular type, and it doesn't treat, it doesn't control. So it's a challenge that we are still facing. We still keep doing a lot of health talks, advocacy and all that, but that's the best we can do, and then encourage those who have maybe support groups, NGOs to also come into play to support. But it's a challenge, really. Okay.
All right. Now, some persons, they say those persons that live with asthma, they don't live a long-lasting life. How true is that?
That's a complete misnomer. Okay. It's not true at all. So asthma is not a death sentence. It's not a death sentence in any way. People live long as they are. You
follow through your medication.
Yes, follow through with the medications. Now, one of the challenges, asthma can evolve to permanent changes in the airway when it's not well controlled. And then there's something we call COPD. It's like, we call it the brother to asthma, but it's common in elderly people, those who farm, those who smoke and all that. Now, asthma can actually get to that, and it becomes more difficult to handle. But for those who control their symptoms properly as they move on, they can even do those things. Like for those, there's some people that will come and tell you initially, oh, I can't even exercise, I can't sustain running or jogging. And with medications, they go back to their normal lifestyles. This footballer that used to play for Manchester United, I can't remember his name at the moment. There are many athletes who are asthmatic and they are doing well. So it is not a death sentence in any way. People have lived as long as over 100 years with asthma. And when they come to us, they tell us, I've been asthmatic since I was a child, for 80 years, for 50 years. And they're coming with other complaints, aside respiratory complaints. So asthma it doesn't shorten the lifespan. As long as you are doing the right thing, it won't. Okay.
All right. So some persons, they would not be able to get or to know from what age do parents need to start checking out on their children to know, oh, this is what is about to happen to my child. So at what age?
Okay, so I'll say diagnosing asthma in children is still quite a bit of a challenge, because there are many illnesses that occur in children that are similar to the same symptoms that comes with asthma. So, and children cannot do those investigations that we do in diagnosing asthma, because of course they are children, they cannot sustain the blow as well as they should. So most times we tell parents, be more observant. If your child is ill, has a cough, difficulty in breathing, there are sometimes that, okay, let me give an example, bronchiolitis, it can come with similar symptoms, wheezing and the likes, and then they treat and the child becomes better. with antibiotics or antivirals, as the case may be, and then steroids, and the child becomes better. But when this thing becomes recurrent, you know that it is not that infection anymore. Infections should come and go.
Sure.
Now, when this becomes recurrent, so you need to be observant, especially when the child starts to crawl, starts to run. You need to watch out. Is this child having problems breathing while running, while playing? Is it when I spray my perfume, she comes into the room and she starts to cough and tell me, "Mommy, I can't breathe"? And of course, the wheezing. The wheezing is so cardinal in children. It's so common. So these are things that, the little things that one can. So there's no particular age to say I'm observing this child. From when the child is born, just keep observing the symptoms. Not every cough is asthma. Not every cough is an infection as well. So one needs to look out for the symptoms that would result, things that you do to trigger that thing. That way you'll be able to tell, okay, this is not normal. Take the child for evaluation. I advise parents not to keep doing self-medication. A lot of people will just say, "Oh, I don't give them cough medicine." It's still a cough. Sure. At that point, the person should be taken to the hospital for proper evaluation. Yes, that's it.
Okay. All right, Dr. Ibi Firi, thank you so much for being part of the program today, talking about asthma. Now, in an overview, your advice to parents, children, and also, the government, because they also have a big role to play in our health, the facilities and all of that. So, want to know your advice, please.
Okay, so first of all, to parents, please look out for your children, look out for symptoms in children. Don't ignore every symptom as, oh, the child is pretending. There's some parents that pretend. Now, for those who are adults, stick to your routine, come for follow-up, come for checkups, don't miss your clinic follow-ups. And then for the government, we seek support. We seek support in getting medications for people to reduce the menace of the acute attacks and deaths from asthma.
Okay.
Thank you.
Also, I will add my own to non-governmental organization. Now, you have enough. Please go out there and, establish an outreach for these persons because they need it a lot. All right, so we'll be seeing you again next week for another exciting time on healthy living. Remember, yes, we talked about asthma. You need to go check it out and see if you are in a good condition. Health is wealth.